Lean forward for me. I'll see how she bends. So there's a segment here that doesn't move well. I'm going to evaluate mobility. Well, it's mobile enough here. Let's go this way. Less so here. In this segment, there's discomfort here. There's a restriction here. But on the other hand, I can check if this restriction is needed for something. Look, I'm testing. Resist. Strength, strength. If I improve this area, I can just stroke it, which will temporarily reduce the signal from the mechanoreceptors here, and she starts to fall. This means that this area is compensatory. I can perform a procedure here and things will get better right away. But globally, it might get worse after my session. She'll become less stable. And she'll look for new ways to compensate. Not this one, but something else. And the nervous system might find a more costly way to compensate. So how can we find the source of the problem here? Look, I'm stroking this area here. She falls. She puts her hand on a scar, for example. Falls on another scar. Strength, or the time ran out. This affect our mechanoreceptor lasts 5 seconds. She presses on a scar and becomes more stable. So this movement restriction here is serving some area. It's needed for something. And now, look, I'm just moving it here. There's a restriction here. Put your hand there. She presses the scar, reducing the signal from it. And I'll see if the restriction decreases or not. And it is decreasing. Yeah. And the movement opens up. So I don't work here. The spot to address is here. This is compensation, this is tension, and it will return here after a while. After you work on it, the nervous system will still create and return this tension to protect the scar. Now, watch. I work with this input here. We change the input from that receptor, and the protective reflex settles. Now let's look at the back. What about the back? I'll move the back. And the movement here, well, it's much freer. We didn't do any manipulation at all. Feel the difference? And it's painless and comfortable. I'll check. Now this area is efferent. I'll stroke this area again. Remember how she fell after the stroking? Hold. That's it. She's not fallen. And this is a very quick way to talk to the body and the nervous system through the postural component.